So I've been really upset the last 24 hours or so, and I've been trying to figure out why I'm so upset. And then I realized what it was. So when I see the same drugs that were used on my sister Adrian 16 years ago, when I see those same drugs in clinical trials today for advanced liver cancer, I am beyond discouraged. I am so upset. It it's so frustrating. And there are many new therapies coming out for advanced liver cancer, which is encouraging. But the problem is these new therapies, all of them, they are palliative care. They're not curative. Their goal is just to extend life by maybe a few months, or if someone's really lucky, 12 months. And so those patients with advanced liver cancer, they don't have a shot. And I just feel like in the last 16 years, there could have been so much more progress for liver cancer patients, and there hasn't been enough. And here's the problem. So, liver cancer, and I'm talking about primary liver cancer, hepatocellular carcinoma, or HCC, is highly preventable. And I could go through all the different causes, but I'm just going to touch on the three primary causes of liver cancer. I'm not going to go into all the different sort of genetic diseases that are really, really in the minority, but the three big causes are infections such as hepatitis B, which we now have a vaccination for, and hepatitis C, which we now have curative drugs for. And in this country, hepatitis C is by far the most common cause of primary liver cancer. And then we have lifestyle choices. So you're probably more familiar with that. So alcoholism causing cirrhosis, which leads to liver cancer. Not in everyone, by the way. Um, Obesity, which is causing NASH, and non-alcoholic fatty liver disease, also known as NAFLD. So both of those are typically caused by obesity, and they're metabolic diseases, but they show up in people who have issues with weight and nutrition and other things. So those are lifestyle choices. And then the third category is environment. So there are certain things in people's environment, less so here, but for example, there's a I think it's a mold that's an aflatoxin that's found in Asia that contaminates food, and that's a known cause. And there are other chemicals as well. So those are kind of the three categories. So infections, lifestyle choices, and environment. So liver cancer is seen as a highly preventable cancer, and I don't argue that. I don't at all. And if it's caught in a very, very early stage, it is curable for most people, especially if they don't have an underlying liver condition. It's very curable. If they have an underlying liver condition, it comes back 50% of the time. 50% of the time. And most patients don't even know that. But if it's caught early, there is resection, which is surgery, or a liver transplant. And I know patients who have survived. And when it's caught early, it's almost always by accident or through surveillance because the person did know they were at risk. For example, they had hepatitis C or they have hepatitis C, so they have been getting regular scans. But those people are in the minority because here's the rub. The liver is this amazing, complex organ. And unlike the gallbladder or the spleen or even the colon or the bladder, or even like one of your kidneys, we need the liver. We can't live without the liver. The liver is the only internal organ that regenerates. I mean, it's a phenomenal organ. It has so many different functions. And but the rub is the liver does not have any nerve. I'm so sorry. I'm so upset. The liver doesn't have any nerve fibers. So the liver, you don't feel pain in your liver. And that is why most people don't get diagnosed with liver cancer until the advanced stage. It just doesn't happen. Um, and and typically, when they're diagnosed in advanced stage, it's because their liver has become so large, it's now pressing on other organs, and that is the pain they're feeling. So, for example, when my sister was diagnosed, the way she described her pain was, I can't breathe, sissy. And that's because her liver was now pressing on her diaphragm. So she kept holding her right ribs, but the liver was pressing on her diaphragm. The liver itself was not in pain at that point. And that is not uncommon for people to complain about a pain or even have some acid reflux, because again, the liver is this very large organ and it's now putting pressure on all the other organs in your um, uh, in this area. What am I trying to say? I don't know. I'm so upset. But anyway, I just feel like in the 16 years since my sister's been gone, there should have been more progress made. How can the same drugs that treated her, that utterly failed her, that had zero chance of curing her, by the way, zero chance of curing her, how can those drugs still be in clinical trials? Like that's ludicrous to me. And how come the drugs that are coming to market are just palliative? It is so difficult when a patient calls me and they're on a drug and I know it's not curative, but they don't know that. And they don't know what stage they're in, but I know based on the drug they're taking that they're in an advanced stage and that they're dying. And they might have 3 months or 6 months or 9 months. Who knows? I mean, the care has definitely gotten better. There's no question. But, and people are living longer. But really, there is nothing for patients with advanced liver cancer. And the one thing I wanted to do with my nonprofit Blue Faery was to make sure that liver cancer didn't happen to other people. That's all I wanted. Like, no one deserves liver cancer. I don't care what you did in the past. I don't care if you have hepatitis B or C or how you got it. I don't care. No one deserves liver cancer. It is so extremely painful and devastating. And the liver is so vascular, and tumors feed on blood supply, right? And the liver has so much of that. So when you get liver cancer, it tends to accelerate very rapidly. And then it spreads to other organs like the lungs or bones. And now my cat's joining us on this rant. But I'm just really discouraged. I know I shouldn't be. I know progress has been made, but this is raw and uncensored, and sometimes you just have to cry because 16 years and not very much has changed. And I feel like at 45 years old, I've got maybe like 30, 35 more years on this planet. And, but I don't know if that's enough time to see a huge change. And honestly, if I thought I would have done well in medical school, I would have become a doctor. That's what I would have done. But I just knew that like science is not my forte, and that's why I didn't go to medical school. So instead, I started a nonprofit, and we're trying to raise funds. But the bottom line is there has to be a better way. There has to be a better way. You know, I mean, Steve Jobs didn't know how he was going to create the iPod or the iPhone, but he just knew. He saw the vision and he knew there had to be a way. And that's how I feel. Like, I just challenge all of you. I challenge the doctors and the scientists and the researchers. I challenge you to find a better way for advanced liver cancer patients, because I am tired of so many people dying. over 600 to 700,000 people in the world die of liver cancer every year. And many people I know who work in the international communities feel like that number is severely underreported. I know one woman who believes it's way over 1 million. It's awful. And I know there are a lot of other cancers out there, don't get me wrong, but most cancers in the United States are on the decline. They're going down. Liver cancer, it's going up. So please, please do something. Do something. And if there's any way I can help, not in this state, of course. Normally I'm not like this. Let me know. And please check out Blue Faery's website, www.bluefairy.org. And I swear I'm not normally like this, but I've just had it up to here.